Good evening, everyone, and welcome to Pause for the Truth. I am Jocelyn Turner, and so delighted to have you all on tonight. Tonight's discussion is going to be a very important one as we continue in our conversations about all of our favorite subject or not so favorite subject, and that is COVID-19. Our focus tonight is on children. And of course, always joining me, although I can't see him, Dr. Kane, how come you're being incognito tonight? What's going on with your, oh, there you are.
I just found I just realized I was live, so I was brushing my teeth.
Oh, you're not supposed to share all the family secrets. What is going on?
Just kidding, just kidding. No, I forgot I turned the turned the camera off.
Well, thank you and welcome, Dr. Kane, as we again continue our discussion. And, when we decide what show to talk about, just to let our listeners, viewers know that we discuss topics that are happening, that are current and important to all of us, or most of us anyway, who, if you have children or if you have, and they don't have to be your own children, nieces, nephews, or whatever. So we're always concerned about what's going on with our babies. So tonight we are fortunate to have some very distinguished guests among us. And apparently I go way back with one of them. I didn't realize it, but the other one, we already know about my long-term relationship, friendship with Dr. Jeff Goldhagen. Dr. Goldhagen, how are you this evening?
I am well. How far back does that go, actually, Jocelyn?
Um, I had long black hair at the time, so we'll just go from there. I
And
won't
Jeff
say
had
how much.
And I had hair, so
Jeff
I
had
was
an
gonna,
afro at that time.
I had a fro, as we called it back in the '60s.
and we also have Dr. Nicole Alexander. Apparently, we worked together at the health department. Jeff, it might have been during the time that you were there, but welcome, Dr. Alexander. How are you this evening?
I'm good, and I apologize for any background noise. It would be my kindergartner dancing, so we'll see if she gets out.
Oh man, we need to let you zoom the camera over to her so she can be some entertainment for tonight. Well, thank you and welcome both of you. So obviously, and Dr. Alexander. Well, first of all, let me do my little piece of saying. Dr. Alexander is an OBGYN. Dr. Goldhagen is a pediatrician. So just for point of reference for the discussion, um, Dr. Alexander takes care of the babies to get here, and once they get here, Jeff will take care of them, and Rogers will take care of the parents, right? So, just some context with our discussion tonight as we talk about COVID-19. So, I'm going to start by asking Jeff. Jeff, what are you seeing? I know you
So,
practice in the
sorry.
hospital primarily. And what are you seeing in the hospital? If you can share, obviously, what you can share, or even what you hear others are saying as far as children and COVID in hospitals.
Well, so we have the most children we've had during the whole pandemic actually in hospitals now. Some of them are in there because for other reasons than just to happen to test positive for COVID. So between 25 and 50% of the kids are there because of that reason. But we still have a very significant number, the most that we've had since the pandemic began with COVID and suffering from a diagnosis of COVID. Most of them are now infected with Omicron. The Omicron virus is not as severe as the previous variants, in particular Delta. So the kids that we're seeing in the hospital are sick enough to be in the hospital, which is not a place we want any of our children to be. But not as many of them are finding themselves in the intensive care units. So the good news is that the children that are being hospitalized are not as sick as they were previously. The bad news is that because of how many people are getting infected with Omicron, that there's still a very significant number of children actually in the hospital today.
And again, I know you can't say specifics and you may not refer to where you're working in the question, but are they mostly school-age children or a mixture of babies or younger children and not in school yet?
Well, interestingly, it's the younger kids that seem to be impacted more significantly than the older kids. And in part, that's due to the fact that they're not vaccinated, which is really, if people take one message home with them, it's that they need to get their children vaccinated, and they themselves need to be vaccinated. And kids now from 12 to 18 now are eligible for boosters. With respect to vaccination, 2 doses of the vaccine is not enough to protect from Omicron. It requires 3 doses, which in the past we've referred to as a booster. Now we're thinking in terms of this being a 3-dose vaccine requirement, not really a booster. It's really requiring 3 doses of this vaccine. So if you love your children and you want the best for your children, which we all do as parents, then there's only one thing that you need to do for the most part as a priority is to get vaccinated. Nicole can talk to us about the babies, and they are also at risk for this disease as well.
Well, Nicole, sounds like that was your cue to chime in.
So I can't speak as much directly to babies, but I can speak of like mother-child dyads, as I'm an OB-GYN doctor. The Delta wave hit Jacksonville very, very hard, and I personally witnessed the loss of multiple moms, and that's always tragic, but to see it happen over and over and over again here in the city was incomprehensible. One of the hardest things as an OB-GYN doctor now is even though people kind of heard that message that we were losing moms and these babies were eventually going home without mothers from the NICU, is that still around only 29% of pregnant patients are vaccinated nationwide. And I would hesitate to say that that's actually probably an overestimate here in Jacksonville. So as a OB-GYN doctor, what I can honestly say is we have so many different studies that show that vaccination is safe during the course of pregnancy. It decreases the risk of stillbirth, so the chances of having a baby that doesn't survive pregnancy. And it also passes immunity on to your baby. So like how Dr. Goldhagen was saying that really our littlest ones are tending right now to be incredibly vulnerable. Well, as a mother, you have the ability to give your child just this like little bit of fight through cord blood and through getting vaccinated while pregnant. And if vaccinated, continuing to pass those antibodies on while breastfeeding.
One thing you said that I'm sorry, I don't know if you saw me, but my eyes probably got bigger, is that you've lost several moms as a result of COVID. Is that what you said?
Yes.
Wow.
Not several, more than several.
Wow.
Yeah.
And see, that's a conversation that we don't typically hear about, in terms of the number of pregnant women who have lost their lives to COVID, and then even further, the heartfelt comment after that the babies go home without the moms.
Yeah.
Do you know what I mean? So just the thought of that is just the dark picture that you see that just joined us is a very active and concerned parent, and her name is Agata. Thank you, Agata, for joining us. I know you're kind of in transit. That's what happens when you have children. You're on their schedule, they're not on yours. But Agata has been very active and outspoken at school board meetings and really rallying parents, talking about the importance of getting kids vaccinated. Welcome, Agata. How are you this evening?
Hi, Jocelyn. Thank you. I'm doing really well. I am in a parking lot trying to get the street light to capture my face here for you guys a little bit. Yeah, the only thing I have to add to this conversation is that both my children have been fully vaccinated. They're 6 and 8 years old, so we're really lucky that they were able to be vaccinated. And my mind has been put at ease the last few month or two, since they've been fully vaccinated and back in school, in a way that it was not possible before they were vaccinated. We still have them masked in school, which I know a lot of parents have chosen not to. But that's given us a sense of comfort a little bit. Although, in an ideal world, we would all be vaccinated and all still be masking with this wave currently upon us. I've known more people in my circle who've caught COVID with the Omicron variant than I have with Delta or anything previous to that. And luckily most were vaccinated and boosted. So they just kind of, were able to stay home and in bed and not hospitalized. But it is scary, the time that we're in right now. And I think that the kids, it's just like all of us are carriers and can be carriers and are deeply affected by this. So I'm personally grateful for the vaccination for my kids, but I do feel for parents whose kids are younger than mine and were not able to be vaccinated. And I don't know what it's like to be in those shoes right now, especially with this variant in our community.
So Jeff, you as you're aware, there are 3 vaccines out there specifically for kids. Which one are we using at this point?
Well, it's the Pfizer and the Moderna. The Pfizer's has been licensed for boosters. The Moderna is right behind it for kids. So
just to add, my children are in the Moderna trial. I have a 2 and a 5-year-old, and I've heard that the EUA is just around the corner.
Yeah, but it doesn't really matter if your kid's got Moderna and you can get the booster. You can still use the booster from Pfizer. So the punchline is get whatever vaccines you can get at the current time. And the issue of this being generally a less virulent disease, a less severe disease, is probably true. And kids that get the disease can spread it, and in particular, they can spread it to unvaccinated adults. So essentially, all of our adults in the hospital, and Rogers, you can comment on this from the perspective of being a family medicine doc. They're essentially all unvaccinated, and the tragedy is that people who don't need to die are dying.
And I mean, that comment is basically what you just said, and that is, 99% of those that are in hospital that require hospitalization have been the unvaccinated or under-vaccinated.
Right.
Vaccinated. They did not get the booster, the 3-dose series, as you previously noted. And most of them are only getting maybe 1 dose, or they got the Johnson & Johnson. I've never been a big fan of Johnson & Johnson's vaccine, but they, because it was a one and done, as they say. But it never really offered the protection, in my opinion, as the mRNA vaccines. And so those that are hospitalized are basically those that are unvaccinated or under-vaccinated.
And now we have to worry about flu-rona. Someone told me, I was at a meeting yesterday, and she said that her friend's 6-year-old has flu-rona, has the flu and corona at the same time. Now, again, just think about that. Your baby, your 6-year-old. Agata, you mentioned that you have a 6-year-old. I mean, I couldn't imagine that parent, but realistically, our children go to school every day. Well, your children, because I don't have children, but children go to school every day. And I've had teacher friends to tell me, they constantly all day long ask the kids who do have masks on to, pull the mask up. But children just, it's a constant. And then I listened to the news where it said yesterday that administrators are going in to teach in classrooms because so many teachers are out. I mean, what do you all say about that?
Well, I'll let the two mothers in the show talk.
I mean, I have a lot to say about that. I think when I heard the news that even our superintendent was going into classrooms to sub for classrooms, my first thought was like, we could have avoided this. You know, we know that masking works. We know that we can slow the spread of any virus, especially one that's as contagious as this current variant, by consistent mask use by everybody. That we could have perhaps protected our teachers who are in these classrooms day in and day out. Both my kids actually the last few days have been home with a high fever, and luckily they tested negative for COVID. So I'm hoping it's just the flu. My son seemed to have recovered really quickly. My daughter is still kind of in the thick of it, but we've kept them home just in case. But again, you know, even that, right? When we've got the flu going around and coronavirus, wouldn't it be great if everyone just masked up and kept it as consistent as possible so that we could avoid loss of time in school for both teachers and children?
I'd like to just comment real quick on that. The last year, we expected, at least I did, I expected a really high number as far as the flu was concerned. And I know we did a big campaign, flu vax, get vaccinated, and people did get vaccinated. But one of the reasons that we did, you know, that we didn't see such a large flu infection or infection rate is because they did mask up. Mm-hmm. And that kept us from seeing so many flu cases back then. But what it really highlighted is the benefits of wearing a mask, protecting you from both corona and the flu. Because the flu by itself, as we all know, can be deadly to some people, depending on the level of immune competence, especially. But I couldn't let that pass without saying the benefit of that mask is huge if people would just wear the mask and not listen to those political crazies that are telling us not to wear the mask that really doesn't cost anything.
So Nicole, I have a relative who's pregnant right now. And again, I can't move past what you said, but it looks like you're about to make a comment before I ask my next question.
Oh, I was just, and me and Agatha have talked about this offline. I wish at this point we weren't talking just about masks, because we could be talking about fitting kids for KF94s, which they make great elementary school KF94s that could fit down to a 2-year-old. We could be talking about ventilations in classrooms. We could talk about like alternative places for the kids to eat lunch outside. And here in Jacksonville, we're still stuck on the very first step of protection for our children and our teachers. And I just wish we had the ability to say and do more to help protect both of them.
Right. So well, because of that, and specifically because of that, parents need to take other precautions that otherwise they may not take. So, for instance, don't take your children indoors in general. If you take your children indoors, make sure they're masked. Don't take your children indoors.
Oops.
Oh. He's paused.
Jeff froze on us.
Yeah, and just to add, and before he comes back in, I concur with him.
Yeah, I'm back.
You're back.
Go ahead.
Go ahead.
Well, and then don't associate, don't have your children associating in close contact with people who are unvaccinated. Mm-hmm. You don't know who's vaccinated, who's not vaccinated in public, but you do know which relatives are vaccinated, which relatives aren't, and only allow people into your home who are fully vaccinated. And by that, as Roger said, that's 3 doses of the vaccine. It's amazing to me how many people are pro-vax, have their 2 vaccinations, but have procrastinated to get their booster. I know so many people, and the reality is, as we've said, that the 2 dose doesn't it doesn't cut it with Omicron. But let me just comment, Jocelyn, on what you said. When you said now we have to worry about Flurona, I'm worried about the next variant, and the next variant is on its way. There are a couple of possibilities that are out there circulating already. We lucked out with Omicron. It could have been far more virulent and caused far worse disease than the Delta. The mutations could have resulted in that scenario. The reality is it's probably less severe, but that's only a matter of luck. By definition, the next variant, the way viruses work, will have to be more transmissible than Omicron, and then we don't know whether it's going to be more virulent or not. So that's what people need to be worried about. And again, they need to be vaccinated in order to ensure that when it hits, and we saw how quickly Omicron,
Oh, looks
How
like we
quickly
froze again.
Omicron spread it throughout the nation. As a matter of fact, Fauci was on earlier making the state. He pretty much made the statement almost everyone will be infected with Omicron. What scares me, one of the things that scares me the most is a Deltarona type strain, for lack of better description.
Yeah.
One that is as infectious as Omicron, but it's as vicious as the Delta virus. And that really scares me in terms of that strain showing, or something similar to that strain showing up.
Yeah, and that's true. And Jeff, by the way, I have gone out and just, I'm getting dinner to go, but I have been so amazed at the number of families that are going in crowded restaurants, eating indoors. And I've even seen adults have on masks and their children did not. So, and the other thing that gets me is, again, I have friends or colleagues who are educators, and they said, they've committed their lives to educating the very babies that we all care about. Well, they wish that people who are against vaccines would at least send their children to school with a mask to protect them, because they also have babies. They have children. They don't want to go home to, take the virus home to their own family. So when we talk about respect, it goes both ways. You know what I mean?
Well, I think one of the other things that I've seen, and I would concur with all our panelists, when it came down to, a lot of this political, because people took a certain level of comfortability that the virus wasn't going to affect kids. And so I think some of the residual political garbage that we heard prior to Omicron is still hanging out there in the weeds, so to speak. And a lot of parents a lot of people think that, well, it's kids, so it won't affect them as much. And they're kind of immune to it. Anything you got to say with that, Jeff or Nicole?
Yes, it's it's the continuing. I have a lot of things to say about it. It's a continuing disinformation. For sure, kids were less affected than adults, but they were certainly affected. And the decisions that were made by the CDC and others represented a complete disregard for children and the susceptibility of children. So when the mask issues came out, or mask suggestions came out, recommendations came out of CDC, they completely ignored the fact that at that time, kids from birth through age 11 weren't eligible for vaccines, and still were making recommendations without concern that, in fact, kids under the age of 5 aren't eligible for vaccines. So in general, there's been a complete disregard for children throughout this whole pandemic, which means And Agata and Nicole can talk to this. It really means that parents, and mothers in particular, need to be making the right decisions in order to protect their kids, because society isn't. And one of the earlier you asked a question, what can you do? And you can sum it up in one word: vote. These are political issues. They're political issues that are being perpetrated by the right wing, this would look like a different environment if there were different political leaders in place. And so now's the time to vote. And I would say, since many of your audience are African American, this is a issue of utter racism. That the issues that have been impacting the Black community have been completely disregarded by the current political leaders. And kudos to Mr. Frazier for making that point when DeSantis was here. So make no mistake, this is a political issue that the children are being used as pawns for sure.
Exactly.
Nicole, what do you say to your expectant mothers when helping them to make the decision to get vaccinated? I won't say when telling them. I'll be politically correct and say when helping them to make the decision to get vaccinated or not.
So I found, when vaccines first became available, that people had a lot of questions and a lot of concerns, and we'd go over the science and, how we would be passing on antibodies to baby and go over the safety profile of the vaccine. The hardest thing right now is I don't know how many more of my patients are vaccine hesitant versus anti-vax, because now they've been available for a long time. I try to bring it up to every pregnant woman, literally because I don't want to see any more die. And the amount of pushback I've gotten is just
unbelievable.
Yeah. So I wish more young women who are of childbearing age or who are pregnant just had a little bit more of an open mind. I understand from a historical perspective that I understand why people wouldn't trust the government. I understand why people would be scared in this situation. But I wish I had a better way of presenting the information, or that the media had a different way of presenting this information, so more young women would get vaccinated.
Dr. Alexander, are you able to tell the stories of the mothers that you've seen die as a result of COVID versus nobody dies as a result of the vaccine, to those patients who are hesitant?
I have. And once again, that's where I don't know how many more vaccine hesitant patients there are, because I feel like my message is often falling on deaf ears. And I can almost cry about that right now. Sorry. It's just, I really wish people understood how bad this could get, and how Dr. Goldhagen was saying, that this is just this wave. We don't know what's coming up next. And we do have these few tools that we can use to help protect ourselves, as mothers, if we want to be there for our babies to grow up. We have a lot of things, small things that we can do to help protect ourselves.
So Agata, what are you hearing from those, I won't call them vaccine hesitant, I'll use Dr. Alexander's comment, those anti-vaxxers? What are you hearing other parents? And again, I'm asking you because I know you've really been out there, talking about it and trying to encourage other parents to get their children vaccinated and wearing masks.
I mean, I've been hearing a lot of the same things we've been hearing this whole time, that, it's one thing to risk your child catching something outside of your control, and it's another to make the decision to inject them with something that you feel could be harmful to them. And so I think that's a lot of what I'm hearing, is the misinformation is leading so many parents into a state of fear of doing something, taking an action that they feel might be harmful to their child, versus taking the risk of them out in the community catching something that, they feel like wouldn't be a big deal for their kid. And what I struggle with is I've heard stories of friends who've had kids who've caught COVID, been fine, kids recovered, but then they have weeks or months of long COVID to deal with and perhaps long-term health effects. And so, I mean, it just comes down to what we've been talking about this whole time is misinformation of parents, worried to make that leap in their minds, right? To get their kids vaccinated against something that they wouldn't think twice of getting them vaccinated for if it hadn't been politicized the way that it has been. So it's the same. It's like Dr. Goldhagen said, it does come down to politics, and it's so sad because lives are on the line as a result. I do have one quick question, if it's okay, Jocelyn, to ask Dr. Goldhagen, going back to what you said earlier about the importance of making sure that we keep our kids surrounded by people who are vaccinated and boosted. I've come across this. That's how we kind of function as a family. We make sure that we ask people. Can you expand a little bit on why that's important for our kids and for our community, that the people that they hang out with are vaccinated and boosted? How is that benefiting our children?
Well, although individuals who are vaccinated and boosted can catch the disease, for sure, we see a lot of breakthrough. Their rate of transmission, or the rate of transmission of people who are vaccinated and boosted, and which we would say now, as Roger said, a 3-dose vaccine, is far, far less than those who are unvaccinated. And so, far, far less. So that if you're vaccinated and boosted, then you have a far less chance of actually harboring the virus and spreading the virus. And it just comes down to simple as that.
That helps. I think if that message were more widely spread, that we would see maybe more parents taking that seriously.
So for those families who want to get together, and fortunately we live in Florida, how would you tell them to let their children play safely together, families who don't live in the same household?
You mean fortunately as a result of weather?
Yeah.
Unfortunately as a result of politics and government.
Fortunately as a result of weather. I will clarify that. Yes.
Okay.
Well, let me just, having grown up in the North, children still play up north. They still, as a matter of fact, it's even worse because they play in their houses.
But in Florida, we can assume that our children can still go outside. So
which is really the key. If originally we were concerned about transmission outside, and people were wearing their masks and running circles around other people who were running, didn't want to breathe the air. I mean, when you look back, it's pretty funny. I haven't wiped down a cereal box in 2 years, but if the kids can play outside, have them play outside, and that's really key. And nobody knows, right, for sure, but play outside even without masks on. So we learned a lot during the HIV epidemic about risk elimination versus risk reduction. And so we're never going to eliminate the risk. So it's all about reducing the risk. And if your kids can play, have them play outside with others. And if they're inside, they should only be inside with people who are vaccinated 3 doses and if necessary, masked. And I think Gada or Nicole mentioned, or I think it was Nicole mentioned the KN95s, the KF95s. In the partnership website, we have a list of websites that you can order these masks from. And so that's really critical now. It's not about wearing a surgical mask. It's about wearing a KN95 or a KF95.
And that's the
N95, but those Those are too difficult to wear. And then if
And that's
you're
the Jeff.
around
Let me
people,
mention.
then
Jeff, let me
Sorry,
mention.
I'm
real quick,
grabbing
that's the
some.
Partnership for childhealth.org.
Nicole, did I say something that you
Oh,
you
no,
have
I
to
was
leave now?
no. See, they make them with like little dinosaurs now. Those are
Yeah.
my 2-year-olds.
Oh, those are cute.
Yeah. They even make them where you can kind of adjust the straps. Sorry if you can see my crazy dirty house. But yeah, I just wanted to show that.
Yeah.
Yeah. Kind of one of the big things I go over with my kids. We don't want them to stop playing with other kids. They're both highly social. They love their friends. The way we've kind of taught them about this is that this is an asymptomatic. There's a chance that this could be an asymptomatic disease. So just in case you have COVID, how do you want to protect your friends? So if you guys are playing really close together, could you think about wearing your mask just so you don't want to accidentally get one of your friends sick? If you have to go inside, make sure everyone has their mask on because we don't know, we can't tell who has this disease. So kind of operating under those circumstances, children want to protect other kids. That's something like fundamental to like being a human being that somehow adults, I think sometimes lose. But they want their friends to be healthy, and they want to be healthy, and they want to, continue to play together. And that's the way.
Yeah, and that's why I mentioned it, because I think that's why we have so many cases now. People were around their families during the holidays. And once we start and we are, we're bonding and gelling, we want to continue that. Someone just posted a question. Is it true that due to the proliferation of the Omicron variant, we will no longer need to worry about COVID once it sweeps through our country? Is it true?
Rogers, you want to try that? You want to go for that?
You're on mute. You're muted. Now we can hear you now.
Oh, I don't see where that would be true because you keep getting various strains. I mean, you keep getting different strains that come about. And so if it was the measles, which you're not getting that much variability in terms of mutations, then that might be true. But when it comes down to COVID, which is mutating, I mean, I think I've seen like what the Omicron or one of the later viruses may have as many as 30 to 39 deletions and which basically, and mutations, which basically says that virus is just like us. It's trying to survive. So it's going to do whatever it needs to do to survive in human hosting. So, no, I don't think that that's true. I mean, I know that's what the right keep publicizing about the herd immunity and stuff of that nature, but there's no way that is true. And in addition, until we vaccinate the rest of the world, in all honesty, we will continue to see different strains, different variants to show up. And so just like we had the vaccine for the Delta variant was pretty effective. Okay, 94, 95%. Of course, when it came down to Omicron, it dropped some because of the deletions and or variants in terms of what's on that the spike protein. And so and of course the virus just tried to adapt and so that it can continue to live and be transmissible. So the absolute answer to that is no.
Thank you for that roundabout answer. Go ahead.
The other crazy thing, sorry, I just wanted to bring this up, is that I'm starting to see patients in the hospital who previously had symptomatic COVID in like July and August who have symptomatic COVID again. So I don't think it's like this one and done thing that we have, this mindset for like, oh, I caught COVID before, I can't get it again, I'm immune. No,
I'm seeing the same thing in adults. I'm seeing quite a few adults. Luckily, well, most of my patients are of the genetic older geriatric age, like Jeff. Most of my patients are of the geriatric age, and so it winds up that those guys, believe it or not, the older patients are the ones who are, I'm not seeing a whole lot of COVID infections because they are wearing the mask. They are doing everything we ask them to do. They are getting the vaccinations and so on and so on. My younger patients are the ones who either are coming down with COVID or passing it along to their mothers and aunts and uncles, because my older patients are really protecting themselves against the public contraction. I mean, being out in the public and contracting COVID, but it's their own family members who hadn't gotten vaccinated or whom are not really being cautious as to who they are around, bringing it home to those more vulnerable elderly patients.
Yeah, and I just since we've been on this podcast, I got a note from someone to say that their child's school, they got the school notifies you of things happening at their child's school. Yeah, several cases of COVID yesterday and several cases today, and it's just Tuesday. So as the week progresses, and so I don't know what we can say to people that you want your children to go to school. I remember, last several months ago, people were fighting, demanding that their children go to school. So now you don't care who teaches your children, since we know that teachers are going home sick with COVID. Administrators are filling in the gap, but what happens when they run out of administrators to fill in? Are you
I
not
will say,
concerned? Are you not concerned about schools closing
I
again?
will say, JT, I just have to give this example. Last Tuesday, I think it was, I thought it was going to be a nice, easy day. I had maybe like, my usual 15 patient schedule. Thought it was going to be nice and easy. Before the end of the day, I wound up with 27 patients, and 17 of them were COVID positive. And it was mind-boggling to me to see that many in one day. I mean, it was just turning over and turning over. And it's like, when does this stop? And so when these teachers, and I have teachers, I mean, many of my patients are teachers, or many teachers are my patients, whichever way you want to look at it. And they're calling in sick, calling out sick, however you want to phrase it. They're calling in or calling out sick. And so who takes their place? I ask them, I say, who do you take that? And a lot of them say, look, I don't really care because I'm just afraid of what's going on in the school system. And I am really tired of having to go to work every day and face the risk, even for those who have not been infected, face the risk of coming down with COVID and not having a good outcome. They are fearful. They're very fearful for their lives. And I do this, and Jeff and I both, and as well as Nicole, and all of us, we sit back and we step into that arena of taking care of people because we're putting our lives at risk. It just irritates the hell out of me when these same people, don't feel my advice about getting vaccination is valid, that it's not trustworthy. But as soon as they get sick with COVID, all of a sudden now they want to come to see me and ask me what to do. Why is my advice before COVID worse than my advice after COVID?
Yeah, I'm glad you brought that up, Dr. Kane, because I was going to ask Dr. Goldhagen and Dr. Alexander that question. I mean, just the fact that you both have, all of you have patients that come to see you. They've chosen you because they obviously trust you. Now, Jeff, we know that you're in the hospital and that might be a different situation, but historically, people do seek you out for advice. Well, why is it on the one hand, they trust your judgment for their care, but when it comes to this virus and this vaccine, all of a sudden you're not trustworthy? Why do you think that is?
Well, I think we need to look at who they is. That they is not everybody. They is, and to a great extent, it's divided along political lines, and it's a different, it's a different world than it was before, and that's really very, that's very concerning. That there are hundreds of millions of people in our country who would prefer to listen to the disinformation on Fox News than to their trusted provider. And so I can't answer the question why, except to say that it's very concerning. And not just because of this issue, because it represents a larger divide. And I don't know. I don't know what the answer is. But as Nicole said, and Rogers and I, and you in particular, through lots of federally funded grants, have worked really hard over the last couple years to really figure out what the right message is and how to gain the respect and educate folks. And now we're at a point, as you said, Nicole, you don't know who the vaccine hesitants are from the vaccine resistors or the anti-vaxxers. And, we're in a situation where there's really very little that we can say to change the minds of folks. But I think what Roger said earlier about the herd immunity is really, Lorene husband had asked the question. This is a global issue. It's not an American issue or a issue of high income countries. This is a global issue, and until we are as committed to solving the issue amongst the low income and middle income countries, we'll continue to expose ourselves as well.
So Jeff, how many children would you say are hospitalized with COVID? Are there a lot, or just several a week?
No,
or?
there's the numbers that in the hospital at any given time are less than 10 at this point. So it's not a large influx of kids, for sure. But as you mentioned, and as we've said all along, we don't know what the long-term impact of even mild infections, asymptomatic infections, are going to be in children. And so, time will tell. And ultimately, at the end of the day, if you can prevent your child from being sick, it's better than letting them get sick.
And I agree, Jeff. While Omicron may not be as severe as the Delta variant was, we still don't know the long-term consequences, even of the Delta variant. And of course, we saw all the myocarditis and the other issues that were associated with the Delta variant. There's nothing written in stone to say it's going to be isolated only to the Delta variant. And we don't really know what long-term, long COVID effects you may see in kids and adults from this Omicron variant.
But I'd like to ask Agata, you were very active. A number of us were very active and the school board was extremely courageous in putting in the mask mandates, a while back. Then DeSantis passed, and the legislature in their special session passed these demonic laws that prevent communities who want to implement mask mandates or whatever from responding. And so from your perspective, and Nicole, from your perspective, I mean, you have your fingers on the pulse of what's happening in the schools. Are parents, where are parents, and what are parents demanding? Where's their voice at this point? Or have they just gotten tired
That's a great question. I think it's a mixed bag from what I'm seeing. I think the parents that have been kind of aware and concerned about this all along, continuing to be aware and concerned, and send their kids to school in the best masks that they can find for them that will not only protect other kids from infection from their kids, but also their own kids from infection from others. So I've, spent a lot of time and money trying to find those best masks for my kids. even though they're vaccinated. But I think it's true. A lot of us are getting tired, right? It's natural to be getting kind of worn out by this and thinking, okay, well, if my kid hasn't caught it yet, then they're going to be fine. This variant is more infectious, but less serious, or it seems to be the case. But I think what's important is for us to remain aware and to keep in mind what you guys are seeing in the hospitals, what Dr. Kane is seeing in his office, of these numbers continuing to just grow and skyrocket right now with this current surge. And I know that in my own personal life, we've gotten a little bit lax. We've had people over for game night here and there, fully vaxxed and boosted, but still, I think now for instance, when my son came down with a fever and we were worried, oh my goodness, is this it? Has he caught COVID? He's double vaxxed. What if this is it and he's caught it, anyway? And I get thinking back and how easy it would have been when those people were over to, instead of having game night indoors, to switch it to outdoors. We were in Florida. The weather was perfect. It wouldn't have been a big deal. We have excellent outdoor seating. We have excellent outdoor lighting. But I think it's just important for us to continue to be a little bit more purposeful in how we want those social interactions in our personal life, and we can't control what the school has done and what the school how their hands are tied, right, in regards to masks for our kids, but we can control how we conduct ourselves personally and in our social lives. And I think since we came close to thinking our kids might have COVID, and I looked back and thought of times where I could have been a little bit smarter and had those difficult conversations with people and asked beforehand, hey, are you vaccinated? Are you boosted? I'm going forward. I'm much more likely to have those difficult conversations and to continue to kind of be on guard, right? And to make smart decisions going forward until we know that the risk is less. And I think that that's important for us to keep in mind, that the risk is high in our community right now. We've got to stay active in our desire to keep our kids safe and our families safe. And it's not easy. It can be uncomfortable. It can be really odd, right? To ask someone, like you might ask him, do you have a gun in your home? And is that, my kid's going to be playing in your home? This is something I need to know. We've got to continue to ask people, are you vaccinated? Are you boosted, to protect our kids in our community?
We have a quick. Go ahead. I'm sorry.
Yeah, and I was just about to say thank you, that someone who's an educator said that kids are staying home sick with symptoms of COVID, but returning back to school without being questioned. So when you talked about having those conversations, and sometimes it is uncomfortable to have a conversation with your friends and saying, so, have you been sick? You haven't had any symptoms of COVID? But what I also like what you said is, when you started noticing symptoms in your child, you then think of how it can disrupt your life, right? But we need to think about, what do we need to do for it not to disrupt our life, not react to it once it happens. Then we really have to think about, and let's face it, there are people I know who've had COVID and they said they had to go to work. They felt okay. They still went to work. They're the people who are, just the people who we come in contact with as we are going out to businesses. So as we're nearing the last 5 minutes of the show, we like to give our guests an opportunity to, this is your plea. You're on Facebook, YouTube, LinkedIn. We're blasting this everywhere. I want to give each of you the opportunity to say your last couple of minutes of, what do you say to people? But first, I have to say, we have another. I am fearful that COVID will become the new society boogeyman, just a story to tell people to take a day off of work. Oh my, that's interesting. But one comment that I wanted to make, and you don't have to comment on it if you want, but before I went to bed last night, I saw the story in Canada. I actually saw it on Jimmy Kimmel Live, when he talked about, in Canada, there's a certain part of Canada, you can't go into a liquor store or a weed store without showing proof of being vaccinated. I can't imagine that would ever happen in Florida. However, how innovative people are trying to get to encourage people to get vaccinated. And coincidentally, by the way, we had, one of the program that I worked with, as Jeff mentioned, is we're working on educating people about COVID, helping to dispel those myths. We have community health workers out in the field talking to people, and they're saying, well, we talk about how the vaccine will help you feel better. And the one gentleman said, this beer helps me feel better. Of course, that's a joke, but we really are trying to tell people as much as we can about it. And I have to give a shout out to, before I let our guest speak, I have to give a shout out publicly to, I'm going to refer to him as Dr. Jeff Goldhagen and Dr. Rogers Kane, because of their foresight, their concern for this community, they started the Population Health Consortium of Northeast Florida. It's an organization of people representing, different segments of our community, who literally, were meeting every Thursday night, trying to, strategize and what can we do to help our community. And so I just wanted to publicly thank them for their tireless efforts. And Agata has also been a part of it. And I did join the consortium. And we've had community conversations, really town hall meetings, trying to do our part to tell people we're not making this up, folks. This is real. And so listen to us. And the reason if you're chiming in, you're one of our weekly guests, and you're like, oh God, they're talking about COVID again. That's because if you did not hear what Dr. Alexander said, she's had several patients, pregnant women who've died, whose babies went home without them, right? So this is serious. I'm going to shut up, and I'm going to give Agata the floor as a parent and give your final words for our viewers.
Thank you, Jocelyn. For me, it's just a continued message, and this is just for myself as much as anyone else, to stay vigilant. I think I've gotten tired and lazy and kind of made decisions that I, looking back now, wish I hadn't, just because they were too risky. And I think it's just weigh the pros and the cons. How are you going to feel if your child gets COVID and then either has long-term effects as a result or passes it on to somebody else who then dies? Like, this is not a game, and it's a minor sacrifice to make, to have those difficult conversations when you're engaging in some kind of social activities with people. And we need to continue to stay vigilant, since this is not over. We're in a.
Thank you. Dr. Alexander?
So I just wanted to kind of touch on a few different points. First is that here in Jacksonville, we still have PCR testing available. I know in other parts of the state, it's very hard to come by, but here we still have, places that are available and free. We always use the Emmett Reed Testing Center. And there are also rapid tests, if you can get your hands on one, that if you must, be in a closed area with another family or another person, you guys can all, if you have them, do rapid tests right before. And I know we're talking about being vaccinated and boosted, but that would just be one more step to try to keep everyone around you safe, is if you all do a rapid test right before you get together and it's negative. It's a tiny amount more of reassurance. The second point I wanted to bring up that I hadn't heard of you guys talk about as much is that, like, right now our hospitals are at their breaking point. I do mostly inpatient work. We have so much staff out sick, and our hospital is so full that there might be 60 or 70 people literally waiting to be seen in the ER. They could be having a heart attack, going into diabetic ketoacidosis in the waiting room, and there's literally no beds for these patients to go to once they get admitted. So I know we talk about this strain as being, less virulent, making people less sick, but it's still, so maybe our ICU numbers aren't as high as they were, but there are still a lot of people going to the hospital, and they're taking beds away from those who would otherwise need them. For a patient with cancer who needs surgery, that surgery is getting canceled again. Or someone literally having a heart attack, if there's someone with COVID who's, vomiting, and that takes up the bed, that's someone with a heart attack who can't get care. And my third point, as a mom, or as, if anyone is out there who's pregnant, this is all so scary, and I know we're all so tired. But just kind of like think big picture. If you want to continue to protect your family and continue to protect your child, make sure that you're doing what you can to get vaccinated. If you have questions, please ask. anyone in healthcare, we'd all love to talk to you about it. If you are, vaccine hesitant but do have questions, we'd love to answer those. And secondly, just do what you can to protect everyone around you.
Thank you. And thank you for acknowledging the hospitalist and the work that they're doing, and the fact that this is taxing our hospital care system. Jeff?
Yeah, I'm not sure I have anything more to say than we've already spoken about. This today is focused on children, and we all want what's best for our kids, and sometimes it's a difficult decision to make. But the data is really clear. We've vaccinated, more than 1 billion people, hundreds and hundreds of millions of people. We know the vaccine is safe, and we know the downside risk of getting the disease is far worse than any potential risk to the vaccine. And the one thing you can do for your kids is to get them vaccinated and get yourselves vaccinated. And it's just a plea.
Thank you. And Dr. Kane, what are your final thoughts for tonight's discussion?
Okay, so like Nicole, I think we have to keep in mind that these hospitals are at a breaking point, nearing a breaking point of being able to accommodate care to even non-COVID patients. So we have to be very cognizant of what impact that these COVID patients are having on the non-COVID related issues, and that the risk that it posed to their lives. The second thing is, I understand about COVID fatigue, more or less, but the virus doesn't get tired. We may be tired, but that virus is not tired any whatsoever. And it will continue to infect at will, and again, in this effort to remain viable and remain, to live just like we are. And one of the last thing is that we must use everything in our armamentarium to be able to help defeat this virus, or at least for people to live despite this virus. So, we have to stay vigilant with testing, stay vigilant with the vaccine, stay vigilant with masking. There are some new drugs coming out, some pills or whatever that Pfizer has, and some other entities that may also be added to the armamentarium. And then maybe we can take a lesson from Canada and give free marijuana to everybody that get vaccinated. So that might increase our vaccination rate. No, just kidding. I don't want anybody to think that I'm an advocate for marijuana use as a cure for COVID.
I heard it. I don't know what you did, Nicole. Did you hear that? I heard it. There you go.
Well, thank you. Thank you all. Thanks to all of our guests. And Agata, she just texted me and said that she got a call and that knocked her off. So we appreciate Agata Gardner, Dr. Nicole Alexander, Dr. Jeff Gohagan, and of course, my co-host, Dr. Roger Kane. Hopefully from tonight's discussion, you all see the importance. If you're a pregnant woman watching, if you have children, please make sure you all get vaccinated. It's safe, folks, for all of us. It's safer for you to get vaccinated than for you to get the virus. Can't say it any simpler than that. If you have any future show ideas for pauseforthetruth.com, please email us at info@pauseforthetruth.com. And of course, stay tuned as we tell you what's really going on. Good night.
Night.
Good night.